Hi everyone. We're going to start with the first question. It says, hi doctor, I'm 24 weeks, but I'm unable to take the folic acid tablets due to its smell, nausea and headache. Can it affect my baby? So at 24 weeks, we're in the second trimester. So we have past the stage where folic acid is the most useful. It's usually the first trimester, the first 13 weeks, which is very crucial when the part called the neural tube is developing, and it will later form into the baby's brain and spinal cord. So that's when you need the folic acid the most. Past that, you need more of iron supplementation, and it is normal to have issues, especially with the smell and the taste of the supplements. So I would recommend maybe changing the brand. Try to take your supplements when you're taking food, so during the course of the meal it helps to mask the taste, and also incorporating sources that are iron rich in your diet, like liver and spinach, and you can keep on switching until you find the right supplement for you. Then the second question is, I'm 5 weeks pregnant, but I'm not feeling anything except smell. Is it normal? So yeah, it's normal to have very few or sometimes even no signs of early pregnancy. So the common symptoms that are experienced are nausea and vomiting. That's most commonly referred to as morning sickness, but also people experience fatigue, dizziness, sore breasts, and well, among other changes. But it's also perfectly normal to not experience anything at all. So what I'd advise is, if you're still in the early weeks of pregnancy, like now you're 5 weeks, it's important to have an early scan. So at around 7 to 8 weeks we can assess for viability, but also as early as 5 weeks the location of the pregnancy can be assessed. So an early scan is advised to follow up. Then the other question is, I have had 4 CSs and I want to be pregnant. Is it possible? So yes, it's pregnant to be it's possible to be pregnant a 5th time, but that also means you'll be going in for your 5th CS, which ideally we consider now a high-risk pregnancy because of the number of CSs. So there is really no limit to how many CSs you can have, but what we advise is to be conscious of the risks with the repeated number of surgeries. So the more surgeries you have, then there is a high risk of complications, especially with where your placenta forms and how deep it attaches into the wall of the uterus. So it's good to be aware of those risks. Then the other question is, 5 weeks pregnant and I have been bleeding for 3 days. What could be the problem? So the first thing I would say is to seek some health care, because this is outside the period when we expect that is implantation bleeding. It's around day 13. So if you're having bleeding or spotting during the early days of pregnancy, it's important to visit your healthcare provider, and usually what we recommend is a scan, and we also reconfirm the pregnancy test. So it could be an issue with how the placenta is attaching, so an early bleed, but also it could also be a sign of miscarriage. So you need medical attention as soon as possible. Then the other question is related also. I'm 14 weeks pregnant but bleeding. Am I safe, and the baby too? So 14 weeks we've crossed over into the second trimester. So this is also not quite normal. So you also need to seek your healthcare provider, have a scan done, have assessment done. Most of the time, depending on the size of the bleed, then we'll be able to advise if at all there is a placental bleed. At times you may need to be on hormonal support for a duration of your pregnancy. Then the other question is, I'm 15 weeks, first time mother, and no movement yet. I usually hear movement starts at 12 weeks. Kindly advise. So for movement, its perception is different for first time mothers and for mothers who have been pregnant before. So for first time mothers, you can expect it from around 16 to 20 weeks. For mothers who have been, pregnant before, and we usually expect that they start a bit earlier, around 14 weeks. So you still give it time. I would say 15 weeks is quite early, so give it a bit of time before you start feeling the kicks. And then there is a question here. Okay, it's more of a statement. Fibroids in pregnancy, kindly advise. I think that's a very broad statement. So I think it depends on how many there are, what's the size, what's the location, will they affect delivery or not. So this is a very broad thing, so I think it would be good to be clear and specific about what exactly you would like to know. Then the other one is, can 22 weeks show gender when done ultrasound, or when ultrasound is done? Yes, 22 weeks can. So typically when we are able to tell the gender is when you're coming in for your anatomy scan or anomaly scan, and usually from 18 weeks onwards, but it can be detected as early as 13 weeks. So the time we advise is when you're coming for your anomaly scan, which for us is around 18 to 22 weeks. Then the other question is it possible for a 7-month pregnant woman to give birth? Yes, it is possible. So 7 months is around, say, 32 weeks. That is still early. So if it is something unavoidable, then yes. But if it is like a planned delivery, I do not see a reason why we would be delivering at that time. So unless the cause of the delivery is unavoidable and we have to go in, then yes, you can deliver. And usually at that time, the weight of the baby is relatively good. You might have a bit of challenges with breathing difficulties and weight, bringing up the weight, but it's generally a baby who's with good support can survive. Then how about babies born with cord around their neck? Is it worrying? Usually no, but I think it usually depends on when is this detected. So if it's detected like during a routine scan and you have more than one loop of cord around the neck, then we discuss your delivery options. If it is one loop around the neck, then we will generally allow you to try labor. But there are many people who may come when they are already in labor or they are about to push and they didn't know that there was a cord around the neck. So it only becomes a significant factor whereby it's maybe tight and it affects the outcome of the baby. But for it really depends on when you're able to detect the cord around the neck. Though it's important to know that babies usually have cords around the neck many times, and when they're still in utero and you're not in labor, it's not something we worry about unless there is something that's flagged during your clinics. Then the other question is, I'm 33 weeks pregnant, but I have a lot of yellow discharge down there. So for this one, again, I would advise a review, because there is some kind of discharge that's usually normal during pregnancy and it's a lot. but also there's some discharge, which means that there might be an infection, and occasionally we will take a swab and we'll test it out and see what is there. But there are some which typically by their appearance you can be able to tell what it is. So there's a lot, not just the color and the amount, there's also the smell and the appearance. And then the other question is, can brucellosis cause miscarriage? The answer is yes, and it can also cause death of the fetus in the while you're still pregnant. So but it is something that is treatable still. Then, is it normal to have a bit of swelling 7 months after C-section infection? So I'm assuming this is around the wound, so I think it's important that we see what kind of swelling is there. Sometimes it is the wound that has had an exaggerated response, so it forms something called either a hypertrophic scar or a keloid, and it's something that can form even after you've had an infection. But I think it would be good to know what kind of swelling it is. There are also people who get hernias, which is like an abnormal opening on the wall of the abdomen, which can permit some contents of the abdomen to pass through. So it's good to have an assessment of what kind of swelling exactly it is. Then what about you have twins and the first baby is cephalic and the second baby is breech? Can I go for a normal delivery? So I'd say this is not advisable unless both of the twins are in cephalic. And then there is also a lot that goes into deciding whether you can have a vaginal birth. So generally, for safety reasons, we would prefer CS delivery, but the kind of placenta you have, if the babies are sharing a placenta, or if they are not, or if they are sharing one sac. So there are babies who have one placenta, different sacs, one placenta, one sac, which means they likely came from one egg which split. Then there's babies who have two placentas and separate sacs. So I think it depends on what kind of twin gestation it is. So there are some which absolutely, no matter how the babies present, it's not safe for you to undergo vaginal delivery. So for this, you need good sit down with your gynae and discuss on what is your plan of delivery and why. And for this specific reason, let's assume maybe you could have a vaginal delivery, say, but if the second twin is breech, then you might have a delay in that delivery. So generally, we would prefer, if you're going to have a vaginal delivery for twins, let them both be cephalic. That is, they're coming with their heads first. Then the other question is, my BP is going up every now and then. I am on medication and I am 38 weeks. Is this normal? Sometimes I have difficulty in breathing. So first things first, you're 38 weeks. So you should be discussing your plan for delivery. If you have high blood pressure, we prefer delivering in and around that time, 37, 38 weeks. So this is also something you need to discuss with your healthcare provider, and the medication that you're on, maybe it's not the right amount of dosage, or you need to switch to a different drug. But at 38 weeks, you need to be discussing delivery at that point. And then the other question is, I'm 4 months CS as a result of ectopic pregnancy. So you had a surgery for ectopic, and you're asking, can I conceive now? Can I give birth naturally? Is it advisable to go for family planning? So I think these things are not necessarily related. So if you're going for family planning, it means you are really on debating about whether to get pregnant or not. So I would advise 6 months from the date of your operation. Then you can start trying. If you want family planning, it can be offered to you at this point in time. And can you give birth naturally? Yes, it is possible. Then the other questions are, can I get pregnant without a uterus? Please answer, I'm stressed. So I think this should ideally come as part of counseling when you're having your uterus taken out, or let's say it was something unavoidable and during surgery something happened and we had to take the uterus out. So it's really a comprehensive discussion to help you cope, because without a uterus, there have been 71 documented cases. This is from PubMed, which publishes articles about medical things. So 71 documented cases of pregnancies after having your uterus taken out, but unfortunately they've been ectopics. That means they grow because there's no uterus ideally, so they attach outside of the uterus, and usually this is in the case where the ovaries were preserved. Yes, so the long and short of it is I think you might need to consider other things like adoption. You probably need to go through some counseling, some therapy, especially if you have no children of your own, because it's likely a dream you will have to give up on. And then the other question is, I was using microgynon pills and I haven't used them for 3 months now from Jan. How long can I take to get pregnant? So if you're on family planning before, then we give it about 6 months, but it depends on a lot of things, like how regular is your cycle, how long do your periods last, how frequently are you having sex, what's the timing of the sex. So you can come in for a consultation or a review to address those issues. Yes, and then you can start on preconception care. So start the supplements, generally optimize your weight, you can exercise, good diet, and improve your chances of getting pregnant. Cut out alcohol, cut out drugs, also for your partner who you're trying with. So there's two sides of the coin, remember, there's not just you, there's also your partner. And then the other question is, mimi niko na swali, na feel uzito pande ya right, I'm 5 months pregnant, kunaweza kuwa na shida, I'm a first time mom. So this generally doesn't sound like a problem, but I'd be curious to know how is your clinic attendance at 5 months. This is about 18 weeks or so. So have we done a scan, and are we able to clear that there is nothing actually wrong? But most of the time it depends on the placement and the positioning of your baby. Yeah, so unaweza feel your uzito, it doesn't usually indicate that there's something wrong, but usually it's good to follow up with some imaging. So those were the questions we had before. We'll take a few more. So what if I don't like meat and I'm already 24 weeks pregnant? I'm a CS candidate. So I think I don't understand the relationship between the two and the worry, but there are many sources of proteins. You don't have to do meat. You can do beans, you can do green grams, you can do plant-based diet, and it will not affect you as long as you're on your supplements and yeah, you're on good follow-up. So I'm not sure what is the story around the meat, but you can, it's possible to be healthy on a plant-based diet if your pregnancy is not tolerating the meat. Then the other question is, I'm having cramps na due date ya scan ni leo. Then okay, so these are different questions. So I'm having cramps na due date ya scan ni leo. So this means that you're supposed to be delivering today by scan and you're having cramps. So cramps, usually the easiest way to define the beginnings of labor. So it could be possible that you've gone into labor. Most of the time, how you would know is if you're having lower pains in your lower tummy. Usually they extend to the back. So it starts on your lower tummy, it extends to the waist and all the way to the back, and it increases in frequency and intensity. So if it was coming after every 4 hours, then there's a shortening of the duration of time, and maybe you're having more and more of those pains. So this could be a sign that you're in labor. So if the due date is today, then you could do with attend your hospital, have a check and see unaweza kuwa umeanza go into labor. Then the other question is, when should a first time mom start antenatal clinic? As soon as you discover you're pregnant, that's when you should start. So as soon as you discover you're pregnant, you come, we start you on supplements. There's usually basic testing to be done and imaging. Then how long does a CS mom take to give birth normally? So this is also another question where there is no standard, duration of time. But usually after you had your CS, we usually tell you to take at least 9 months to a year to heal, and then after that start trying. So there's usually no set timeline. Also, there are some instances where if the interval is too short, then we will not allow you to labor. Let's say if you get pregnant within 3 to 6 months of your CS, then there's a high likelihood we will not allow you to labor, because it's the timing between the two scars is a bit short. Then I think we're done with these ones. Then the other question is, I want triplet boys, what do I do? So mostly triplets might not occur naturally. There are instances when they do. So if you have like a superfetation or something called superovulation, so then there's a possibility that you might get triplets. But most of the time, this is something that will occur with IVF. So I would highly suggest that you have a sit down with your gynae and talk the specifics about how to go about this, and specifically where you can choose the gender is IVF. Otherwise, naturally occurring pregnancies, you will not be able to choose the gender of the baby. Then the other question is, why induce someone with pressure instead of CS directly? So pressure is not an indication for going in for CS. There are some instances where if you have pressure, we might choose to deliver you through CS if it is the faster method. So let's say if you've gone into a fit, like you have convulsed due to the pressure, and the CS is the fastest way to deliver you, then we will. But having pressures, especially if they are well controlled, is not an indication for CS, unless you have a specific reason why you would prefer CS over induction. But again, this is a highly individualized discussion, so you should have discussions on your birth plan with your primary healthcare provider. Then the other question is, why do people spot when pregnant, and how long should it take? So spotting can sometimes occur where there is a threatened miscarriage or separation of placenta in the early stages of pregnancy. And how long should it take? Oh, and also implantation. So during early days, say day 13 or 14, when there's implantation taking place, then there's usually some spotting. So it's one of the danger signs, and that's why we advise that whenever you have spotting, you seek your medical attention as soon as possible, so as to detect whether there is an issue or not, because you can be offered hormonal support if at all the pregnancy is salvageable. And then the other question is, want to get girls, is it before or after period? Again, I think these are it's more of a myth. There is usually no sure guarantee to get a specific gender unless you're doing IVF. So the other question is, how long should one continue with pregnant care supplements? You can continue for as long as you'd like, even after delivery. So when you're pregnant, we advise you continue with supplements until the last day of delivery, but it is also encouraged that you continue to use these supplements after delivery, because they boost your iron levels. And then which is the latest month to be injected with anti-D? Also, are there supposed to be 2 injections? So this is specifically for moms who are rhesus negative blood group. So we usually give you an injection at 28 weeks to protect you for the duration of the pregnancy, but we also give one after delivery within 72 hours. Then there is also instances where you can get anti-D within the pregnancy. That is not either of those 2 times. So if you have bleed during the pregnancy, then you get the anti-D. If you happen to be pregnant and you get a miscarriage, then you'll also get the anti-D. But there can be more than 1 injection during the pregnancy, especially if there was a period of bleeding where, or an instance where you might have been, the fetal blood might have been exposed to your system. And then we'll take the last questions now. My scan date for delivery is approaching, but I'm having cramps during the night. Is it labor? So I think we've covered this. What could be signs of labor? So labor, the cramps, they are usually not just down there in the tummy. If it is labor, it spreads all the way to your back. So it is possible that it could be labor, but there are also other signs of labor, like your water breaking, having a discharge that is mucus. Sometimes it can be just mucus discharge, you call it a mucus plug. Sometimes it can be bloody mucus discharge. Yeah, so that is it. Then how does one deal with reflux? It's worse at night, and it tends to get worse as the pregnancy continues, because generally the digestion is delayed, and the passage of food through the intestines is a bit slower, so you have more content in the stomach when you're going to bed. So you can adjust your sleeping position, so the number of pillows, so you can prop up kidogo. There is antacids you can use which are safe in pregnancy, and if it's bad, there's also some medication that can be prescribed by your doctor to deal with the acid reflux. And then what causes the fetus not to grow during pregnancy? So it depends on which stage of pregnancy. So if you have a pregnancy that's not viable, the fetus will not grow, and this one is usually the first trimester of pregnancy. But if you are in advanced pregnancy and your baby is not growing, sometimes there could be issues with pressure. They could be also, there could be, if they are twins, there's also something called twin-to-twin transfusion. But this is usually something that needs to be assessed by a fetal maternal specialist, and depending on the stage of pregnancy where you're at, then sometimes you may advise early delivery. Then the other question is, I'm now 38 weeks. Can I deliver anytime? The question is yes. We can go into labor anytime. Then the other question is, how can one do away with recurrent UTIs during pregnancy? So if you're having every time you come to hospital, we are being diagnosed by UTI, and every time there's one, when you attend your clinic and you've had recurrent UTIs, you should have a sample taken for something called urine culture. So we do culture and sensitivity, that is taking a sample of the urine, growing it in the lab, and seeing what organisms come out from it and what medication they respond to. And then after that, that is the medication that is used. So if you haven't had that culture done, then it is something that you probably need to have done. Though some women generally have issues with the recurrent UTIs more than others. Yes, so we will end that session there for today. Thank you for joining us.